Pulmonary embolism.
Okay, so if you have read and understood considering the clinical examination station, kindly please begin.
So I'm going to wash my hands and I'm going to enter the examination hall. Hello, good morning. My name is Dr. Ulfat and my candidate number is 391. Can you please confirm your name and date of birth? Is it all right if I could just take off your oxygen mask? Perhaps if you could speak for me, is that okay? Do you feel breathless if I remove the mask?
Patient is nodding, not responding.
Okay, all right then.
Okay.
So it's all right. I will check your medical bracelet. Okay. Okay. So you're Mr. John, and you're 53 years old. That's all right, Mr. John. So I've been asked to examine your chest and to assess your lung functions. Okay. So I will be as gentle as possible. Could you please tell me, do you have any pain anywhere at the moment? So
Patient
you
is
feel
nodding,
pain
yes.
on your chest? Okay, fine then. Considering that the patient is not being able to speak properly and there is a chest pain, this patient might be suffering from pulmonary embolism. So I would like to follow the critical care and surgical patient management protocol, and I would start my
Very good.
examination through ABCD approach, please. Please, I would like to call for help. If anyone could kindly help me out here and attach the pulse oximeter to the patient, please. And I would like to check the patient saturation. And now I would like to increase a little bit of the oxygen because the patient's saturation is showing reduced saturation. So, Mr. John, I'm going to now examine you. I'm going to be as gentle as possible. Okay. So first, I'm going to assess his airway. Since the patient is able to understand, so his conscious level is intact, and also I'm going to examine his mouth and nostrils to see if there is any if there is any blockade, if there is any foreign body, any sputum. And if there is any, then I will suction. I will use a suction or a forceps to remove any of the any foreign body or sputum that might be there. Now I'm going to go for assessing the breath of the breathing of the patient. I'm going to count the patient's depth of breathing, rate of breathing, and see if there is any abnormal chest movement. I'm going to measure the. I'm going to assess for the chest expansion to see if there is an asymmetrical chest expansion, and I'm going to then auscultate the lungs on either side of the lung field to see if there's any if a breath sound is present, absent, or diminished. If there is any added sounds like a creps, then I'm going to check the patient's. I'm going to auscultate on the base of the lungs to see if there is any crepitations. I'm going to now go for assessment of the circulation, and here I'm going to check the patient's pulse, blood pressure, and also I would like to check the. I'm going to send some blood for at the moment. Simultaneously, I'm going to ask my help to please send some blood for arterial blood gas analysis, and then I'm going to go for the. Then I'm going to start with fluid resuscitation of the patient, but not overload the patient. Possibly, then I'm going to go ahead for since the patient is conscious and is able to respond to me by nodding. I will assess that the patient is alert, and then I'm going to go check the patient's. I'm going to squeeze on the patient's cuff to see if the patient is having any deep vein thrombosis. Then I'm going to. I would like to check the dressing of the patient, please. I would like to remove the dressing if that is okay.
Consider.
Thank you. Now I will check the patient's drug charts here to see if the patient has been given adequate medications, if there is any fluid overload for the patient. And then I will check the patient. I will also inspect the patients if the patient is wearing any stockings or not. If not, then I will ask for the patient to put on some. I'm going to ask somebody to bring the stockings, and I'm going to put the thromboembolic deterrent stockings. Then I'm going to And then I'm going to check the drug chart, like I said, see if there is any medications, if there is, see if the patient has any allergies, perhaps might have given some medications that has caused bronchoconstriction. After all this has been done, I would like to, as I'm doing all of this, I'm going to also inform my consultant surgeon and the anesthesiologist, and then send blood for baseline investigations like complete blood count, urea, creatinine, electrolyte, and also arrange for the patient to undergo a CT pulmonary angiography to exclude the pulmonary embolism.
Now, consider if you have missed anything.
In
breathing, you've done the chest wall movement. Did you do
yes, ma'am.
percussion and auscultation? No.
I forgot percussion.
Yeah, and then
yes,
circulation. In circulation,
yes, ma'am. Circulation.
For the
heart
mouth
sound.
Mouth for dehydration.
Mouth for dehydration.
Eye for the pallor, neck veins.
For the pallor, neck
and
veins,
then heart
SGVP, and the heart. Yeah.
Auscultation. And
yes.
Then there is D for the disability.
He's alert. Drugs, yes. And also the deep vein thrombosis. I've done that. Heart. That, I forgot the heart. Yeah.
You've checked the legs, all right.
I've checked the legs. Yes, ma'am.
What about the raising temperature, blood pressure, oxygen?
Blood pressure I did, oxygen I did, temperature I forgot.
ECG, you'll see
ECG.
Yes.
Yes, I will check the drug chart and I'll check the baseline. I'll send for baseline investigations.
Okay. Yeah, and you'll auscultate the chest from the back as well.
Yeah.
When there is a risk of pulmonary embolism. So
yes, ma'am.
You'll do that and you'll examine the patient in supine position.
Yes, ma'am.
What else have you missed? 15 seconds are left. Okay, can you summarize your examination now, please?
So I have examined a patient, a 55-year-old gentleman who is on his 8th post-operative day following right hip replacement, who has presented with sudden onset of shortness of breath and also chest pain. On examination, the patient was slightly dehydrated and hypoxic. He was alert. He was alert. There was a dressing on the right hip which was not soaked. The patient had there was tenderness on the right cuff, so possibly the patient has developed a deep vein thrombosis. And the patient's temperature was slightly the temperature. I'm sorry, I could not check, but his heart rate and his blood pressure were within normal limits. His respiratory rate was he had tachypnea with hypoxia, and considering all of this, I would say that the patient might be suffering from pulmonary embolism, and I would like to manage the patient according to critical care and surgical patient management protocol.
What investigations would you arrange for the patient?
I will send for baseline investigations, complete blood count to rule out any sepsis. Then I would like any infection indicated. Then I would like to do a ECG, a D-dimer, chest X-ray, and I would like to check the serum creatinine and then arrange the patient for a CT pulmonary angiography. And
in order to rule out
in order to rule out pulmonary embolism.
If you'll do ABGs, what do you expect to find?
The patient will have respiratory acidosis.
All right. And if you suspect patient to be suffering from pulmonary embolism, what would you see on ECG?
On ECG, there is going to be elevation of S in lead 1, Q in lead 3, T in lead 3. Sorry.
Lead 3
and there would be and tachycardia, increased heart rate.
Yes. And T-wave inversion. And okay, can you please tell me how should a pulmonary embolism be managed?
So pulmonary embolism depends upon the status of the patient and the hemodynamic stability of the patient. If the patient is hemodynamically unstable, then patient have to be managed according to the critical care and surgical patient management protocol through ABCD approach. And then definitive treatment will be urgent urgent embolectomy, either a pulmonary embolectomy or urgent thrombolysis by injection streptokinase or urokinase or alteplase. And
What do you
In the-
understand by the term massive pulmonary embolism?
Massive pulmonary embolism would be if the main branches of the pulmonary artery is blocked, pulmonary trunk is blocked, and there is
Compromised hemodynamics.
compromised. There is pulmonary led to pulmonary hypertension, so there is compromised cardiovascular. Yes.
All right. Just
Insufficiency.
suppose you're scrubbed and this patient.
Can you please kindly repeat for me?
Yes, just suppose you're scrubbed and you're in the theater, and
Yes.
a nurse calls you and informs you about this patient's condition.
So in that
What would
case, I'm
you
going
do?
to immediately ask the nurse to kindly arrange for crash trolley.
Very good. All right, good. Thank you.
Thank you, ma'am.
Right. Anything? Okay. One question.
Yes, ma'am.
There'll be two. Okay, thank you. We'll close this and then we can discuss.
Thank you, ma'am.